A new 15-bed infectious disease unit was opened in the New Amsterdam Hospital's compound last Saturday. Jalissa Hines reports.
A new 15-bed infectious disease unit was constructed in the compound of the New Amsterdam Hospital. The unit, which houses male, female, maternal and pediatric wards, was commissioned last Saturday. Regional Health Officer Dr. Vishalya Sharma expressed gratitude to the team of doctors who treat COVID-19 patients during her address at the simple opening ceremony.
I'm absolutely proud that we have our same COVID team with us, headed by Dr. Javid Aziz, who deserves also a round of applause, that we're here today commissioning this building so that we can deliver the quality of care we want under the right conditions. I must also, at this point, acknowledge the efforts, the strides the region has made in managing the COVID-19. In addition to this building, we would have also increased our swabbing capacity in the region from 1 to 10 per month. Today, thanks to our hard-working team, we do close to 500 to 1,500 per week.
The new infectious disease unit will house COVID-19 patients. The region is currently in the fourth spike since the pandemic started,
where the region would have recorded 1,690 positive COVID cases with our fourth spike. Thanks to Dr. Javid and his team, we managed to bring that down as of this morning to 127 active cases in Region 6, with Skeldon 19, Kanji 32, New Amsterdam 39, Kanji River, 1. COVID-19 has taught us a lot of things. Personally, what it taught me the most was the value of teamwork and working together and respect and appreciating each of our team members. So thank you, everyone. Thank you for the good work thus far for the year, and looking forward to even a better team approach as we go forward in 2022.
Dr. Bob Ramnath, Chief Executive Officer of the New Amsterdam Hospital, delivered brief remarks.
This hospital was built 17 years ago. However, it never actually had an infectious unit. So we used to use makeshift areas. So once the need was identified and the will was there, through the RHS, the RDC, the Ministry of Health, the Government of Guyana, once the need would have been recognized, the resources were then gathered and pooled, and the will to get it done was here. I got on the ground at the same time, and I actually, along with Dr. Vishalya Sharma, we together spearheaded and led this operation here, along with many others that you may see in the compound. So out of a need, as long as there is a will, and you're able to organize the resources, you can get something done. Now, this is just another small step in the way forward in healthcare, but it's very important. It is very important.
Regional Executive Officer Region 6, Mr. Narendra Prasad, also delivered brief remarks.
Express sincere thanks to Chairman and Vice Chairman and the team that defended this at the Ministry of Finance. This is something that we normally miss, and people find out why we don't get certain projects, because if we don't justify enough to the Ministry of Finance, then your projects don't get to go. So I just wanted to say that from the onset. This project is also close to my heart, as being a member of the health profession for a number of years also. We just want to make sure that health is everyone's business. A healthy nation is a wealthy nation.
Chairman of Region 6, Mr. David Armagon, during his address, highlighted the lack of facilities in the region for COVID-19 patients when the pandemic commenced.
That when COVID started in this country, we here had to hardly look for a place to house our patients, because there was no facility available in the region for us to be able to put these patients. And we had to contact Gaisuku because Rosal Estate was not functional at the time, to ensure that we get 1 or 2 buildings there that we are able to use temporarily to house COVID-19 patients.
Additionally, he said,
we recognize that there is a need for an infectious unit, a permanent infectious unit, where our patients can be comfortable and the team that are left in charge of looking after these patients are also comfortable. And so I want to join with Dr. Sharma in thanking those persons who attached to the COVID-19 force here in this region, the medical team, for working beyond the call of duty and in extremely difficult conditions, very difficult conditions, to save many lives of persons who are suffering from COVID-19 in this region.
Minister of Health Dr. Frank Anthony delivered the feature address.
You would know that on the 11th of March 2020, we had our first COVID-19 patient. At that time, the country was totally unprepared for COVID-19, and we know that because when that patient came to the Georgetown Public Hospital, the accident and emergency, nobody recognized the patient as COVID-19. And because of that, I think more than 30 persons who came in contact with that patient had to go in self-isolation because they didn't know whether or not they got the disease. We didn't have laboratory capacity to test for COVID-19.
Further, Minister Anthony stated,
they were rationing people, rationing the regions, how many tests you can get. So we don't know the true prevalence of COVID-19 during those early days because we just weren't testing. And there are lots of people, as you know, with this disease who would either be asymptomatic or mildly symptomatic, and if you don't test them, then you wouldn't know. And just to give you an illustration of how much change has come, when I looked at the numbers, for the whole of 2020, we did probably about 38,000 or so tests for the whole of 2020. This year, 2022, for the month of January and a little bit of February, we have already completed more than 74,000 tests.
he then highlighted the importance of the facility.
With this particular Omicron wave that we have just gone through, I said just gone through because I think we are now at the tail end of it. We don't know what will be the next step. We don't know what next will be coming because you still have a lot of people who are unvaccinated, and there are reservoirs of mutations. And what the next variant is going to be, we don't know. So these facilities are not going to be idle because for the next wave of COVID infections, we are even better prepared.
The program concluded with a ribbon-cutting ceremony and unveiling of a plaque. Although the unit is used for COVID-19 patients, it will house other infectious diseases patients after the pandemic has ended. Reporting for Channel 8 News, I am Julissa Hines.